Okay, so I'm headed to my my only visit for the day. I figured out a way to put my phone up so you can see more than just my steering wheel. Hopefully it'll stay up. So yesterday, from part 1 of Day in the Life, really like half day or whatever, anyways, I did not call my first patient because she specifically told me not to call her before I came. And then I went over there half an hour, blah, 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 and she was like, come back next week. So today I called my patient first. I usually don't because she's always home, but she's been feeling like crap lately, and I wanted to make sure she wasn't at the hospital or anything. And right now it's going to take me 32 minutes to get there. It's about 9:30 in the morning. So, wanted to make sure she was home. And she is. So, told her I was on my way. Let me give you some tips if you are a new grad who has gotten a home care job. We communicate a lot through emails with the office. So, before I looked at the plan of care for this patient, I also checked my iPad to make sure that I didn't have any emails or things that I needed to address right away. So far, so good, but it's only 9:30. Home care agencies are generally desperately needing RNs. RNs only can do start of cares, which are necessary, you know, they're necessary. LPNs can do skilled visits and so forth, but only an RN or a physical therapist can, I believe, I want to say a speech therapist can open a case as well, but in general they need an RN. So they really need them, and they can be quick to hire. That was one of my first jobs. I had only been an RN for a few months. I was an STNA for, oh goodness, like 6 years, mostly at one particular nursing home. And so I was working there when I passed my NCLEX. That's actually how I found out that I passed, is the scheduler called me and was like, you passed NCLEX, when can you start training? So I started working there right away as an RN. I didn't care for it because I had worked there as an RN, as a STNA, and it's totally different working at the same place as an aide than it is working there as a nurse. And my personality is more passive, so it was hard for me to like tell the aide, kind of tell them what to do basically, or to delegate to them, I should say. So I got a different job, and it was home care. They hired me like on the spot, and I'm like, great. That particular agency paid pretty well. I did that for, I want to say, like 6 months. It was really hard as a new nurse because I didn't know a lot of things. You know, you learn a lot in school, but you don't learn a lot. Like, there's still a lot to learn after nursing school. You just learn the basics, how to not kill people, basically. So with home care, it's a lot of teaching, and sometimes you don't know enough to teach them. So for a new grad starting out, please do your research. Print out information. Go to reputable sources. Don't go to Wikipedia. Go to Mayo Clinic, American Heart Association, American Diabetes Association. Those websites have wonderful tools and lots of information that you can print out, study for yourself, give to the patient. Another example is if you have a psych patient, you need to look up how to do a proper psychiatric assessment, because that's what they're being seen for. I didn't remember all of that stuff, so I had to look it up, and that's totally fine. You look it up, you print it out, you follow it, and that's how you learn. But it's so important to do that, because otherwise you can't follow the plan of care if you don't know how. Also, do not accept a patient that you are not comfortable with. I made the mistake of accepting a patient who had a wound vac. Bad. That was bad. I thought I knew how to do it. And they were like, do you need somebody to go with you? I was like, no, I think I could do it. Not so much. So that was terrible. And that was terrible. Let me just say that. So if you're not 100% confident on how to do something, you need to tell them. You need to ask what's going on with that patient before you accept them. A lot of times they may just give you the address and say, hey, this patient lives here. Are you willing to accept them? Well, you need to say, I need more information about what they're going to be needing first. A lot of it's medication management as well. You don't learn every med. You can never learn every med. There's like a bajillion medications out there. I recommend downloading Medscape, the Medscape app. It is so awesome. It's basically a drug book, a diagnoses book. It has information on everything. It's free. You just sign up for an account. It's so totally awesome. Like, you have to get it. You can look up their diagnoses. You can look up lab results, meanings, and all sorts of things. It's wonderful. Great resource. I still use it all the time. What else? Always communicate with your office staff. If you're not sure what to do, just ask. If, like I had a patient, they're diabetic, their toenails are super long, they needed a podiatrist. I emailed them, they need a podiatrist, my patient needs a podiatrist. How do I go about doing that? And, they told me. So, that's all. You just ask for help. Ask for training. If you don't know how to do something, you need to ask for training on it. If you have any questions about your documentation, you need to ask for training on it, because Medicare is really cracking down on it, as they should, because there's been a lot of fraud, and your documentation is going to be analyzed by them when they do audits, and you need to make sure that your documentation is accurate and it's complying with Medicare standards. If you don't know how to comply with the Medicare standards, then you're not going to be able to do it. So, the way I do it is print out the plan of care so that you can actually follow it to the T. Make sure you're not missing anything, and cover your butt, basically. Also, if you have a bunch of patients, you want to try to group them by zip code, by area. Try to arrange your patients to where you get the furthest one out first. And then, what is it? It's Mapquest. You can put in tons of addresses, and it will automatically put them in order to where it's going to be the most efficient route. Also, I would recommend two bags. One bag for your extra medical supplies and one bag for your essential supplies that you do need for every single visit. That way you're prepared for instance, I had a patient last week who was complaining of burning frequency and some foul-smelling urine. So I called the doc and was able to give them a urine sample cup thing, because I already had it, so I didn't have to drive half an hour to the office, half an hour back to the patient's house to give him a cup to pee in. So that saves a lot of time. Make sure you're tracking your mileage. I like to use the Stride app. Also, make sure anything you purchase for your job, you're making a copy of that receipt. You know, receipts over time, they're going to fade, so you can make a copy of it so you can put it off on taxes. What else? I don't know. I mean, I'm sure I'm going to have plenty to tell you after I see my patient. So, I will let you know when I get there. Okay, I am here, so I'm going to get my bag together because I use my work iPad as my GPS. Stick that in there, and I have everything already because I looked at my bag before I left. And I'm gonna grab my keys. I have a key fob, so I just stick my key fob in my pants pocket. Like getting in and out of your car all day long, which I'm really not really gonna do that today, but it's easy to lose track of your key and just it's a pain in the butt. So if you just keep it in like your scrub pant pocket, it's a lot easier. I stick my purse in the trunk, and then I'm going to take my jacket off. Put my backpack with my extra supplies on in it. And head on in, and I'll let you know how it goes. Alright, so I've been home for a little while. I was literally at that patient's house for 2 hours. 2 hours. Something was wrong with her incision, so I had to contact the nurse who was managing that. Then I had to call a doctor about her meds. I had to call the pharmacy first, who said I had to call the doctor, so then I had to call that doctor. They told me I needed to call the other doctor for the different medicine. So I called the other doctor, then I had to call the pharmacy again. Then I had to call the daughter to tell her what was going on and how to change the dressing. Had to do the dressing and leave all the supplies with her. At least I had the supplies. So then I just got done documenting everything. And since this is my last week, since I'm leaving, I have to write a summary on all my patients to give to the next nurse. Oh, and I had to call a daughter for my one patient that I couldn't see. If you remember from my first day in life, the one I did yesterday, the doctor still didn't complete the documentation that we need, so I have to call and tell her that we have to discharge her from services. So, fun times. It's okay though. Thank you for coming along with me today. I hope you guys have a great day. Let me know if you are doing home care nursing, if you like it, if you did do it and you stopped doing it, or whatever. So, subscribe if you'd like, and I'll see you in the next video.